Good afternoon, everyone, and thank you for joining us live today. My name is Ebony Caldwell, and I am the Director of Diversity, Equity, and Inclusion at Rochester Regional Health. And I am joined by Susan Jackson, a physician assistant, and Dr. Lori Lerner, both experts in pulmonary medicine with Rochester Regional Health. November is Lung Cancer Awareness Month, and today we are discussing the importance of screenings and health education in lung cancer prevention. We invite people to watch the chat to ask questions, and we'll watch the chat to see your questions and comments, and we will take them as we can. So let's get started. Susan, I'm going to start with you. What programs and resources does Rochester Regional have available to educate people on healthy lungs, lung cancer, and COPD?
Good afternoon. Thank you for having us. Yes, currently right now, I'm representing the lung cancer screening program here at Rochester Regional. It is a program that is designed really to help facilitate lung cancer screening for our patients. The eligibility right now for lung cancer screening, which has just recently changed, is age 50 to 80-year-olds who are currently smoking cigarettes or quit within the last 15 years with what we call a 20-pack year history. So that's equivalent to a pack a day for 20 years. You know, it could be half a pack for 40 years. And that really, the eligibility covers a pre-visit with myself called a counseling and shared decision-making visit, along with an annual CT scan, low-dose CT scans for the screening process. Currently, the visits with me are done through telemedicine, which can either be telephone visits or through MyCare video, in which I explain the screening and the process to the patient, and can answer any questions. And along with the program, we manage these scans for the patient. So we make sure that patients meet the eligibility and that all parties are being copied in on results, as well as communication with their referring providers and their primary care doctors. The part of the visit as well includes smoking cessation support, helping patients that are ready to take that step to cut back or quit, which is, about 80% of the risk for non-small cell lung cancers at this stage. We are working on developing a system-wide smoking cessation program. Right now, we do have some resources out of Unity Hospital that do, I think, provide like a quarterly smoking cessation plan. And we do direct our patients for support with New York Quits. And through the American Lung Association, there is an 800 number that provides several resources for patients for smoking cessation.
Thank you, Susan. It seems like we have a lot of comprehensive resources for education, and we're increasing access by making it so available and in several different areas and ways. So thank you so much for that. Dr. Lerner, I'm going to toss this next question to you. For lung cancer, what are the disparities when considering gender, race, and socioeconomic status in incidence of lung cancer, stage of diagnosis, and survival?
Thanks, Ebony. Those are great questions. Lung cancer, taking even a step back, Susan and I feel pretty passionately about this lung cancer screening program because we both believe that lung cancer in a lot of ways has been a stigmatized cancer. I think there's a lot of shame and stigma involved around it. And for that reason, access to screening or even access to early diagnosis has been really limited. And so as a result, there's so many disparities, no matter where we look between diagnosis, stage of diagnosis, outcomes, there's disparities across race and gender, as well as socioeconomics. Lung cancer kills about 160,000 people a year, and that's more than colon, breast, and prostate combined. So, getting the message out of the importance of screening is so super important. And, the criteria for lung cancer screening includes age and smoking history. But what we know is that there's more factors that increase a person's risk for cancer, and that includes race. It includes number of years that someone's been educated, and also includes BMI and family history as well. And so we have risk models. So we know there's some people who actually don't fall within our screening criteria who probably are quite high risk. So, developing an awareness, one, getting those people into lung cancer screening who actually are eligible is our first hurdle. But then also being aware that there's high risk people out there that still need to be screened. We're hoping as an organization to be able to roll out a program that finds some funding for those people, because right now a real barrier to screening high risk people outside of those official guidelines is really insurance. So as an organization, has shown a lot of commitment to address putting resources towards addressing those disparities, and we're hoping soon to be able to roll out a similar program to that. Let's see, as far as equity, I think that probably covers a lot of the risk factors. Back to you, Ebony.
Thank you so much, Dr. Lerner. I'm going to give you another one here. What should people know about the impact of firsthand versus secondhand smoke on lung health or lung cancer?
Well, first of all, smoking is by far the biggest risk factor for lung cancer. So, quitting smoking is going to be my first, second, and third recommendation for lung health in patients. But secondhand smoke doesn't help. And in addition, any sort of insult to the lung is going to be part of contributing to that inflammatory response in the lungs that probably is contributing some risk. So smoking is a huge risk factor. Secondhand smoke still contributes, not quite as much, but we need to keep lungs free from smoke and tobacco in whatever form it comes.
Thank you, Dr. Lerner. I know in previous conversation, you mentioned something that I found pretty interesting, that our lungs don't have pain receptors, right? And so they're pretty delicate, and we don't know that something is wrong until we're far along the journey of where they're not healthy, right? And so I think it's hugely important to understand that how delicate our lungs are.
That's exactly right. And that really speaks to why lung cancer screening is so important. So we know that without lung cancer screening, that probably 70-80% of lung cancers will be diagnosed in late stage, which is a dismal prognosis. In stage 4 cancer, expected 5-year survival is less than 1%. Terrible. With lung cancer screening, those cancers that we're able to find are by far, the majority are in stage 1A, which has a 97% chance of cure and a 5-year survival without chemotherapy or radiation. So it completely turns that around. And the reason that lung cancer is found so late in stage, typically without screening, is that we don't have pain receptors in our chest. So a cancer can grow and grow and grow before it's causing symptoms. So your bodies or our bodies aren't going to warn us, in time to have a meaningful outcome. And so I guess there's two messages in there. One, get the screening because it's safe, it's easy, and it makes a huge difference. And two, we're on the precipice of turning lung cancer around, kind of turning our perception of it upside down from a dismal diagnosis to really a very manageable, curable disease when we find it early.
Great information. Thank you so much. If you're just tuning in, my name is Ebony Caldwell, and I am the Director of Diversity, Equity, and Inclusion here at Rochester Regional. And here today with me, I have Susan Jackson, a physician assistant, and Dr. Lori Lerner, both experts in pulmonary medicine with Rochester Regional Health. And I'm going to throw the next question to Susan. Susan, does vaping or smoking marijuana put people at a higher risk for lung cancer?
That's a great question, and one that's asked quite frequently. We do know, as Dr. Lerner said, anything that can insult the lungs can cause an inflammatory response, which in fact, cascading can lead to lung disease. There's not a lot of documented research, such as with cigarette smoking, tobacco smoking, that, you know, we can put our hands right on. But we do know clinically that any insult to the lung can, you know, set the stage for disease, which can in turn increase risk of lung cancer. So we highly advocate for our patients to abstain from smoking, smoking vaping, e-cigs, and marijuana, because the combination, especially along with cigarette smoking, is what we call synergistic, which means 1 + 1 doesn't equal 2, it equals 10. So it's putting a major insult onto the lung.
Thanks, Susan.
You're welcome.
And Dr. Lerner, what are a few lifestyle modifications we can implement today to increase or maintain lung health?
Great. Well, so my advice to my patients is that my first, second, and third recommendation for lung health is quitting smoking and maintaining a smoke-free environment. So avoiding tobacco smoke and avoiding secondhand smoke. After that, avoiding other aerosolizing agents that are caustic to the lungs, wearing a ventilator mask if you're working in an occupational setting where your employer recommends it. Also, what's important for many women, often who are in the cleaning industry, is that we're now realizing that aerosolized cleaning agents actually can be caustic on the lung as well. So, basically avoid inhalation of anything that seems like it might be corrosive or caustic to the lungs, and make sure you're not inhaling tobacco.
Thank you. And so I'll leave this one up to either of you to take. For those who want to find out if they're eligible for our lung cancer screening program, what can they do?
Would you like me to take this, Dr. Lerner?
Yeah, that's
so. This is a covered screening through Preventative Care Medicine and the Affordable Care Act. So patients can always self-refer. We do recommend that they do also talk to their PCP. Many of our referrals, probably over 90% of our referrals to the program, come through our primary care providers. So we encourage you to discuss that with your primary care. You can go to our to rochesterregional.org/lung, and our phone number there, 922-5285. You'll talk with someone in the program and we'll guide you right through the steps. And again, even if you don't meet those eligibility criteria, it is still very important that you talk to your primary, talk to your pulmonologist, your whatever doctor you feel comfortable with, or call us, because there may be an option for you to be screened.
Great. So is there anything else either of you would like to mention before we close out today?
Well, just a reminder of maintaining a smoke-free lifestyle and reaching out and getting screening done if you're eligible.
And remember, the screening is a covered benefit, free, no copay for most insurance companies. And we really advocate that our patients maintain that annual screening recommendation. That's where we're really able to really do the best service for our patients, is keeping in line with that annual screening.
Yep. If you're eligible, one CT scan once a year.
Saves a lot of lives.
Great. And that's what we want to do. Great. Thank you for joining us today. Thank you, Dr. Lerner and Susan, for taking the time out of your busy schedule to talk about lung cancer prevention. Again, if you're watching, feel free to leave us a question in the comment section and we'll be sure to answer them. Thank you so much for your time today, ladies. We certainly appreciate it for helping us keep our community safe and to get in front of cancer, lung cancer, right? We want to make that awareness this month, but we want to take it into every month and make sure that we're doing all that we can to prevent, and that is key, just like you said. Yeah, so thank you.
Yes, it is. Thank you, Ebony. Mm-hmm. Bye-bye.